Students under Uganda National Students Association are urging government and Ministry of Health to reconsider the suspension of medical intern doctors. The President Uganda National Students Association says intern medical doctors are entitled to get what the President directed.
The President assured them that they should be given. Then why should someone deviate from the directive of the President? And my position is we need a win-win solution. What the interns are requesting, is it entitled to them? If it is it there? If it is there, why not to give them? If it is not there, is it necessary a letter to come and just chase them away? I believe it shouldn't be the better position to take. What I believe is there a possibility of the ministry calling upon the stakeholders, calling these interns, calling the students-related associations like UNSA on a round table, and we discuss this matter.
The deputy spokesperson, Forum for Democratic Change, John Chikonyogo, wants the Ministry of Finance to release funds that were promised following the President's directive.
Ugandans have a tendency of not caring about the plight of others. These intern doctors, a good number of us who have taken patients to hospitals, know it pretty well. These are the people who come first to attend to your patient. Even if you are very rich and you can transport your patient outside Uganda, you need that stabilization in these hospitals in Uganda, and the probability to meet an intern in the ward when you take your patient there is very high.
In another development, a joint task force has been formed by Uganda National Students Association to join the campaign of voluntary testing, surveillance and school-based care to ensure schools remain open and safe.
So as students leaders, we are requesting our colleagues all the way from the guild presidents, head prefects, class counselors to go on with the campaign of mobilizing students to get vaccinated. This is our campaign, this is a priority. We cannot deviate from this campaign. We know there are some issues, but we are telling the colleagues, please let us vaccinate. And still we request the Ministry of Health, once schools reopen, if they can find a way of bringing the vaccines to school, so that those who have not been vaccinated well home, they can be vaccinated when they have come back to school.
Walunga Yusuf says this is aimed at ensuring that once schools are opened, they run without further disruptions. The task force is to sensitize child mothers and students that have lost hope in education to return to school for a better future. Among the members of the task force is the Mothers Union that is holding a task of counseling children that have lost hope in education.
To children that have become child mothers, I don't think that as this campaign is there in place, I think it has to wait for them to go through this. But they need a lot of counseling, because I just want to believe that some of them ended into this because of the COVID-19 effects. So as mothers, we are more than ready to do the counseling, to be waiting, to be patient, and see them through this challenge, and they go back to school.
The strategies of keeping schools open include vaccination, school-based rapid testing for COVID-19, school-based care for mild cases, among others. Tumwine Brian Biaruhanga, UBC News.